Ever felt like the whole world just stopped? I used to think that was something out of a cheesy teen romance. But then COVID happened, and we all lived it. Like, literally. Streets went empty, borders shut down, and we were all locked inside. What started as just another news story turned into the biggest plot twist of our lives. It felt like the world hit pause as we learned new routines and rules, adjusting to a whole new normal. Handshakes swapped for squirts of hand sanitizer, hugs turned into awkward elbow bumps, and toilet paper became the most prized possession. This is the story of how one tiny virus put the whole planet on pause. Now let's press the rewind button back to December 2019. It's the end of the year, and everyone is buzzing with excitement, planning holidays, buying plane tickets, and looking forward to a brand new decade. But halfway across the world, something unsettling is brewing. Reports start popping up about a strange, pneumonia-like illness in Wuhan, China. At first, it's the kind of news most of us would scroll right past. Just another random headline, right? Well, fast forward a few weeks into January 2020, and that random headline is starting to sound a lot less random. This mysterious virus doesn't stay put, it begins to spread. First in neighboring countries in Asia, like Thailand, the first country to have a reported and confirmed case outside China, followed by Japan, South Korea, and Taiwan, respectively. Not long after, it spread a bit further, reaching countries in Europe and America. Governments are starting to monitor the situation, and people are definitely feeling a little on edge. But life? Life is still going on. Until it's not. By March, we got the news that this virus, now officially named COVID-19, is a global pandemic, which means it's a worldwide health issue. And just like that, everything changes. We go from business as usual to empty grocery shelves, face masks everywhere, and a level of uncertainty that most of us have never experienced before. So, what exactly is COVID-19? At its core, COVID-19 is caused by a virus known as SARS-CoV-2. This name may sound like something straight out of a sci-fi movie, but it only refers to a virus that belongs to a larger family called coronaviruses, which also includes the common cold and other serious illnesses like Sars and MERS. The emergence of this virus marked a significant health challenge for the world. This virus first emerged in Wuhan, China, in December 2019 and quickly escalated from a local outbreak to a global pandemic. COVID-19 primarily spreads through respiratory droplets when an infected person coughs, sneezes, or talks, traveling up to 6 feet. This transmission method is why public health measures like social distancing became essential. Symptoms of COVID-19 can vary widely. Common signs include fever, cough, and fatigue, while some individuals may experience the bizarre phenomenon of losing their sense of taste or smell. While many people recover at home, others may develop severe symptoms, particularly those with underlying health conditions such as heart disease or diabetes. The virus also has a long incubation period, allowing individuals to remain asymptomatic for 2 to 14 days. This delay raised concerns about unknowingly spreading the virus, contributing to its rapid transmission across borders. As the world began to learn about COVID-19 in late 2019, the virus quickly slipped across borders, resulting in a global health crisis. It all started in Wuhan, China, where the first cases emerged, but within weeks, it found its way to neighboring countries like Thailand and Japan. Travelers unknowingly carried the virus, spreading it through airports and crowded spaces. By early 2020, Europe felt the impact as the virus hopped from Italy to France and Spain. It quickly overwhelmed healthcare systems and forced governments to impose strict lockdowns. As countries raced to contain the outbreak, the virus continued its relentless journey, crossing the Atlantic to the United States, where it became the epicenter. With each new case, COVID-19 created a web of transmission that connected continents. By the end of 2020, COVID-19 had infected over 80 million people worldwide, claiming more than 1.7 million lives and leaving families and communities shattered. The staggering numbers tell a stark story of grief and struggle. With healthcare systems across the globe facing immense pressure, countries like Italy and Spain were overwhelmed, with hospitals struggling to care for a surge of patients and doctors having to make heart-wrenching decisions about who would receive care. Now, when it came to responding to this crisis, countries took different paths. Some implemented extensive testing and contact tracing, with South Korea earning high marks for its effective measures, while others, like Italy and Spain, opted for strict lockdowns. Those lockdowns, while painful for the economy, did help slow the virus's spread. But in some countries faced overwhelming challenges. In the United States, the COVID-19 pandemic created huge challenges. Hospitals were overwhelmed with patients, and healthcare workers faced shortages of personal protective equipment, or PPE, putting them at risk. Many people struggled to follow quarantine guidelines, often seeing them as infringements on their freedoms. This non-compliance made it harder to control the virus's spread. Other countries also faced difficulties. Strict lockdowns in Italy and Spain frustrated citizens, leading to protests, while their healthcare systems were stretched to their limits. In Brazil and Mexico, political instability and misinformation made it hard to implement effective health measures, and limited access to testing worsened the situation. Even countries that initially managed the virus well, like Australia and New Zealand, had to deal with new variants, prompting them to reintroduce lockdowns and causing economic strain and mental health issues. As the world faced the COVID-19 crisis, a fierce race began to develop vaccines quickly. Countries were not just looking for health solutions, but also for economic advantages. The first nation to create a vaccine could recover faster and gain global influence. Scientists around the world came together, sharing resources and knowledge. Governments and companies invested billions of dollars because, let's face it, a world where everyone is vaccinated is a world where people can start spending money again, hopefully on things that aren't just toilet paper, face masks, and hand sanitizer. This intense competition changed how vaccines were developed. Traditional vaccine development typically takes years, but advancements in technologies like mRNA allowed for some vaccines to be developed in record time. For instance, Pfizer and Moderna rolled out their vaccines in less than a year, leaving competitors in the dust during this vaccine development race. The global vaccination effort transformed into a competition not just for health, but also for which country would emerge as the next vaccine superpower. Countries like the US, UK, and even China were in a sprint, each trying to showcase their newfound vaccine capabilities. No country wanted to be seen as having a less effective vaccine, as that could hurt its reputation. But wait, just when we thought we were in the clear given the different vaccines being developed, COVID had a few more tricks up its sleeves. Delta, Omicron, and friends arrived like the virus's sequels. These mutations changed the virus and raised questions about how well the vaccines worked. Some vaccines were less effective against certain variants, leading scientists to quickly adjust their formulas and keep researching. While wealthier nations rushed to secure and distribute vaccines, many low- and middle-income countries faced serious challenges. Countries like India and Nigeria struggled to obtain enough vaccines due to export restrictions, limited funding, and logistical issues in reaching remote areas. This created a stark contrast with rich nations. While the US and UK celebrated successful mass vaccination campaigns, others were left grappling with insufficient doses for their populations. Moreover, individuals with existing health conditions encountered additional hurdles. Many of these people were at higher risk for severe illness, but often faced barriers to accessing vaccines. This inequality and lack of access not only harmed public health, but also prolonged the pandemic, as unvaccinated groups became sources for new variants. As vaccination efforts ramped up globally, the tide began to turn. More and more people received their shots, and slowly, the world started to feel a sense of hope. The idea of herd immunity became really important during this time. This makes it harder for the virus to spread, helping to protect those who can't get vaccinated, like people with certain health conditions. With the rollout of more vaccines, countries got closer to achieving herd immunity. As vaccination rates increased, serious COVID-19 cases dropped. Hospitals became less overwhelmed. Restrictions eased, businesses reopened, and families could finally reunite. Streets buzzed with life as people enjoyed meals in restaurants, attended concerts, and traveled to see loved ones, now without masks or constant sanitizing. Though the journey was long, the world learned to adapt, and the dream of returning to normal life became a reality. The collective efforts of global vaccination, the pursuit of herd immunity, and renewed cooperation showed that it can bring back hope and life to the community. As we reflect on the whirlwind journey of the COVID-19 pandemic, it's clear that we've learned some powerful lessons that go beyond just baking bread, taking care of indoor plants, and perfecting our Zoom skills. We've seen how interconnected our world truly is. A virus that started in one corner of the globe quickly made its way into every home, reminding us the importance of science and public health. We also learned to adapt. From virtual celebrations to creative problem-solving, we showed resilience and ingenuity in uncertain times. Remember when we all became amateur chefs, trying to recreate our favorite takeout meals? Some of us succeeded, while others struggled. But those moments of creativity and connection were crucial lifelines that helped us cope. Looking forward, we have the chance to build a better world, and good governance will be crucial in this effort. Strong leadership can help ensure that we invest in our healthcare systems, guarantee equitable access to vaccines, and promote transparency and trust within communities. By fostering a sense of global cooperation and prioritizing effective governance, we can address the vulnerabilities exposed by the pandemic and create a more resilient future for all. So there you have it, COVID-19 in a nutshell. Thanks for tuning in to our journey through the past. If you enjoyed exploring history with us, don't forget to hit that subscribe button. What historical events do you want us to dive into next? Keep exploring and catch us next time for more eventful insights.